During the surgical camps, it's a 4-day event where we do massive mobilization of clients through VHTs, through radio announcements and talk shows on the local radio stations, such that when we get to the health center, the crowds are large because also the health workers have been brought from far to help with the huge numbers.
Reproductive Health Uganda, RHU, and United Nations Population Fund, UNFPA, carried out a 4-day surgical camp in 4 health centers in the districts of Iganga and Namutumba between 2nd and 5th December 2013. Busesa and Bugono Health Center 4s were the camp centers in Iganga, and those in Namutumba were Nsinze and Magada Health Center 4s. The camp focused on provision of family planning services, breast cancer and cervical cancer screening, and voluntary counseling and HIV testing. At the different health centers was a team comprising of surgeons, nurses, and a laboratory technician to provide family planning education and services to the community, to carry out voluntary HIV counseling and testing for community members, to screen women for breast cancer and cervical cancer, and to build capacity for the local health center staff to provide all available family planning services.
I would like to say first of all that we are glad to have our RHU partnering with us for this camp for these 4 days. Me as the in charge of this place, I am really glad because it's family planning, especially the long-term methods, have not been implementing the service routinely, and having this camp has seen many women coming in to access the service, because in the daily activities we usually give the short-term methods, the pills and the injections. But with tubal ligation, vasectomy services, I think they can witness for themselves that the turn-up has been high and the community has benefited because they have been responsive.
In addition to the activity objectives, RHU and UNFPA conducted a family planning training of trainers training for the Somalia health staff in this camp.
So we have to give him, let's get another swing just there.
The village health teams, VHTs, carried out massive mobilization in the communities as well as door-to-door campaigns to create awareness about the surgical camps activities.
VHT tukolagana n'ebigemagana by'obulamu era nga tusaba yawe tetuli kukolagana n'aba Reproductive Health Uganda nga tuli mobilizinga nkani okukumakuma abakyala oba abantu baife mu byalo ebyo okwida okwetanira enkola ebigemagana ne family planning.
Health and family planning education was provided to the community as a way of ensuring they make informed decisions on their health as well as on the family planning methods to use.
Sanzeewo omusomo ogw'okusomesa ku bya family planning y'ekizaala ggumba. Nembeera musomo ogwo nenjigayo kuba nti tuba n'okwekuuma okuba nti tuzaala abaana bangi. Ku bye bayigiriza nonzeeyo okuba nti nkozesa kondom.
Tuliandika akapisozi. Tukeeta kakapisolo. Kano tukakuta mwana omukono. Kano bakalala kano. Kamyaka gitya? 3. Buti eriyo obubire bw'emyaka emeka?
Yabagwetanga ati
gabaga kagamba.
Nako
nakakaweta kabatamuna bantu
munabana
mperano ako omusala ajja kukiiramu mperano.
In all the 4 health centers, voluntary HIV counseling and testing was carried out.
What number did I give? No, some of them didn't have their number, but I told them the number. Yeah, Nati, it simplifies.
In all the 4 health centers, women were screened for breast and cervical cancer in a bid to help them know their status and provide them with information on prevention, early management and treatment.
Iganga and Busesa kwidwaliro okwekebeza obulwaire bwa cancer nekebeza services dibaire nungi era nekebeza muzira buzibu awo enkubirikiza abakazi abanange nti muveyo musituke mwide mwekebeze otegere kiki ekyoli
ndikita plan kaiso kachi kaiso they are only
Contraceptives and family planning services were provided to both women and men, and among these were vasectomy, tubal ligation or BTL, implant insertion and removal, IUD insertion and removal, provision of oral contraceptives like POPs, COCs and ECPs, and injectable contraceptives like Depo-Provera, as well as the female and male condoms.
Ndidye ku family planning iyo bukapisozo bw'emyaka 5. Ndidye nga ndibwenda spacing abaana bange. Nino omwana mulala ayinenze mali emyaka 5 nemali nzaali.
Nga ndidye wano mu idwaliro eri Magada nga kyendi kunoonya nga ndikwenda soke nemerere mu kuzaala mplaningire kuko abaana bange kuba ndiko abaana 6 era nga ndidye wano kunye bukapisozi obw'omumikono njamalako emyaka 5 era nakubiriza abakazi banange abantu banaye kyetaaga tuzaala abaana nga tuzaala abaana ab'okupulaningira.
Nasalawo nti ndikwenda kumusala buseke nga abaana benabo baana 13 bagala 7 abalenzi 6 n'abakyala bange 2 kale nasalawo nabona nga tisobola kwongera ku baana abo kyokubiri kazi bange bajja mu famire b'abantu babisibwa bubi nze n'okusalawo mwene okolaki
The resistance. Now after feeling the resistance, I make this farm on her elbow. Okay?
Also during this camp, RHU conducted a practical camp for the Somalia health staff in family planning education and services provision.
So as UNFPA, we thought we really need to position birth spacing in Somalia because this low contraceptive prevalence rate and the high maternal mortality rate, they are really alarming. They are among the highest in the world. So we decided to have a team of trained providers who are competent to train and also to offer practical experience to their colleagues down in Somalia.
We came here in Uganda, so we came here to do a 2 weeks training for family planning. I have learned a lot, and I've started some implants. I have also done some tubal ligations, and I've also observed some vasectomy, actually one case.
I get a lot of benefit of the family planning and also to reducing the maternal mortality rate in Somalia. And also improves the community, improves the quality of the life of the community.
This was a very good training for us, and we hope what we have learned from here that we will apply to our when we are back home. Then we will try to improve the health status of our communities back home, and also we will transfer these skills to our colleagues back home so we will train them.